All right, so picking up where we left off last time, let's look at bone markings. Bones have certain features on their surface that each one of them is going to demonstrate what we call that that structure function core principle. As I said, I'll say it probably 500 times throughout this semester. Things are made the way they're made so they can do their job, and they do their job. They can do their jobs because of the way they're made. That's the core principle of structure and function. Three basic types of bone markings, and then we're going to go into a little bit more detail about each one of these. But the first one is a depression. A depression is a pathway for blood vessels or nerves or sites of articulation on joints or between bones. What you can have is an area where an area of the bone that's depressed, nerves and things will lay in that depression. Then the next bone that's articulated with it doesn't interfere with that. That's why as we age and our bones start to break down a little bit and our vertebra, for instance, start to compress just a little bit, we start to have nerve problems because that area of the depression is now not as deep as it should be, and it's allowing for pressure. Openings enclose delicate structures and allow them to travel through bone. We'll look at different types of openings where nerves and blood vessels again go through. And then projections, these are sites where bones articulate with other bones or where ligaments and tendons attach. I'm sure in your lab you will spend a lot of time looking at the different articulation points of the bones. So bone markings, again, there's something called a facet. A facet is a shallow, convex or concave surface where two bones articulate. Convex means it's shaped like this. Concave means it's shaped like that. Convex, sort of a bump, whereas a concave is something that is sort of like a hollowed out spot. Example that your book gives you are the ribs. That little structure right there is an articular facet where this rib articulates with the transverse process of one of the vertebrae. A fossa, plural fossae, is an indention in a bone into which another surface fits. Here's the humerus, the distal portion, the olecranon fossa, which is that structure right there, that sort of divot in the back of the humerus. That's where the olecranon process of the elbow goes. That's what prevents our elbow from bending beyond that point. Is there's actually a little piece of bone that goes into that little notch right there. A fovea is a shallow pit. The fovea capitis is the little hole that is at the end of the femur. There's actually a major nerve and blood vessel that come through that fovea capitis. And I'm sure your lab instructor, that's one of the things I always, when I teach lab, that's one of the things that I always point out. That's usually a point on a test is what is the name of that little structure in the head of the femur. Some other bone markings. We have a groove, which is a long indention. Grooves usually are going to be points of muscle attachment. There's a canal or a meatus, is a tunnel through a bone. This one shows the acoustic meatus, which is where structures of the ear go through the temporal bone here on the side of your head. A fissure is a slit in a bone between adjacent parts of bones. Here you see a fissure in the back of the eye where the sphenoidal bone articulates with other bones of the face and skull. A foramen, the plural of that is foramina. A foramen is a hole in a bone. There is the foramen in the frontal bone right there at the upper reaches of the eye. A condyle, these are projections from the bones. A rounded bone end that articulates with another bone. The mandibular condyle is this large structure at the top of the lower jaw. It's where the jaw articulates with the skull and gives us that pivot point. A crest is a ridge or projection of bone. Classic example is the iliac crest found on the ilium. The head is the round projection of a bone's epiphysis. Here's the humerus. That's the head of the humerus, what you see there in blue. We go back one. That's the head of the femur. This is what generally happens when an elderly person breaks their hip. Generally what happens is the bone breaks right in this area right here, which is called the neck, and the head breaks off. If you have someone who's had a hip replacement, what they've had replaced is the head of the femur most often. An epicondyle is a small projection, usually proximal to a condyle. There's the epicondyle right there, found on the bottom of the humerus. That is the, as I'm looking at it, that is the medial epicondyle. There's also one over here called the lateral epicondyle. A process is a prominent bony projection. You have the scapula, you have the coracoid process. Spine is a very sharp process. So while this coracoid process is sort of a blunt item, this scapula, the spine of the scapula, is a very sharp, sort of angled structure. A few more bone markings. We have a protuberance with an outgrowth of bone. There is the external occipital protuberance on the back of your occipital bone, so sort of the back of your head, right in that general vicinity there. A trochanter is a large projection. Another test question: where is the only place trochanters are found? They are found on the femur. You have a greater trochanter here, and then down here there is a lesser trochanter. A line is a narrow ridge. There is a line, the linea aspera. Again, these lines and things are going to give places for muscle attachment or for fine arteries and veins and nerves to pass through under muscles and things like that. Moving on to the skull. The skull. Cranial bones, that's made up of 22 bones organized in two groups. The first group is the cranium. The cranial bone has 8 bones. There are 4 single bones. You have the frontal bone, which most of us think about as our forehead. You have the occipital bone, which is the back of your head. And then you have the ethmoid and sphenoid bones, which are found in the middle of the face, sort of up around your nose and in the back of your eyes. There are 2 paired bones. You have the 2 temporal bones, which are right here where your temples are. Anybody who ever suffered from migraine headaches well aware where the temples are. And the parietal bones, which are the 2 bones on this side of your cranium. So, 2 temporal bones, 2 parietal bones, and then a single frontal, occipital, ethmoid, and sphenoid bones. And there's the picture of them. Here's the frontal bone. Here's the temporal bone. There's one of the parietal bones. The sphenoid bone, let's see if we can find it. It's right here. You have one on the other side as well. That's the other side of it. And ethmoid. Ethmoid's in the middle of the nose. Where is it? Where is it? I know it's here. There it is. The green bone, and here's the front of the ethmoid bone right there. So there's the back of it, and there's the front. The other bones, the other 14 bones, are the bones of the face. They're called the facial bones. You have 6 paired bones. You have a pair of maxillae. The maxillary bones, you might think of that as the upper jaw. That's where your top teeth are. The zygomatic bones, that's the bones that are here. Your cheekbones, if you know somebody who has really high cheekbones, models have high cheekbones. Those are the zygomatics. Nasal bones are the 2 bones found right here in your nose, not this part down here. This part down here of your bone is cartilage. The nose is cartilage. If you feel up, you can feel where the bone starts, and my nasal bones start right about there. Nasal bones are sort of, if you wear glasses, where your glasses sit. The lacrimal bones are to the inside of your eye, interior corner of your eyes. The palatal bones, that's the bones of the roof of your mouth. Toward the back, the hard palate, you may have heard of the top of your mouth being referred to as your hard palate. That is made up of the palatal bones. And the inferior nasal conchae bones, these are bones found well back in the back. If you look when you're in lab, for instance, and you're looking at a factory-made skull, for instance, You look way up in the nose, you'll just see these sort of little bumps on the nose, on the face, on the inside of the nose. Those are the nasal conchal bones. If you were ever lucky enough to see a real, thank you, a real skull, a real human skull, I studied on some of these over at UALR. Some of the issues with real skulls is these nasal conchae bones, after a very short time, are going to be broken because they're very delicate, and just literally handling the skull, being very careful, can break those nasal conchae bones. You have two single bones. You have a vomer bone, which I'll show you in a minute, and the mandible, which is the lower jaw. Back up to the picture. Here's again, there's the zygomatic bone of the cheekbone. There's the lacrimal bone right there on the inside of the eye. The nasal bone's here in blue. The vomer bone is that little bone right there underneath the ethmoid bone. There's the maxilla, the one in pink, and there's two of them. It's divided right there in the middle, so you have one over here and one over here. There's the jawbone, or the mandible. All bones of the face are fused to one another at immovable joints, with the exception of the mandible. An immovable joint, and we'll talk more about joints in the next chapter, is called a suture. So you have a suture that holds those bones together. Many bones of the skull contain air-filled, membrane-lined spaces called sinuses. 4 bones surrounding the nasal cavity contain very large sinuses called the paranasal sinuses. If you have sinus issues, you have seasonal allergies, I've got a sinus headache, it's the paranasal sinuses that are usually the culprit. Again, here's the bones of the skull, the cranium, frontal bone, parietal bone, the sphenoid bone, the one in sort of purple. The ethmoid bone is the green one, the temporal bone, the yellow one, and the occipital bone is in the back. Again, it forms the back of the vault, and it's pictured there in blue. Then you have the facial bones. Here's the 2 facial bones. The lacrimal bone is there. The palatal bone is there in the back. The zygomatic bone, sort of dark pink one. The inferior nasal conchae bones is right there. The vomer is this dark blue one. The maxilla is the sort of pale pink one, and then this sort of orangey, rusty red one is the mandible. The cranial vault is the superior portion of the cranial cavity, and we talked about that earlier. The cranial base is its inferior portion. It is divided into 3 indentations: the anterior, middle, and posterior cranial fossa. That's where the brain sits. The brain is perfectly folded to sit in those indentions, and there you see the indentions of the vault. There's the posterior. Remember, posterior always means toward the back. So there's the posterior cranial fossa, the middle cranial fossa, and the anterior, and then this portion back here is referred to as the vault. You also have special sense organs found within the cranial cavity. You have the orbits, which contain the eyes, the nasal cavity, which houses our sensory receptors for smell. The oral cavity is where you find the teeth and tongue, along with the taste receptors. And then there are some other small cavities, which we will talk about, that contain the organs for hearing and balance. If you've ever heard of someone having their equilibriums off and they can't stand very steady, it's those structures that are causing a problem. Again, so here's the cranial cavity. This is a skull cut. Well, never mind, it shows it to you right here. You just simply cut the face away, and this is what's left. Here are the orbits. It's where you'll find your 2 eyes. Here are the paranasal sinuses. The nasal cavity is right here. That would be that inferior nasal conchae bone. There's the oral cavity there. And again, all of the things you see in green are the paranasal sinuses. Again, just another overview of the skull, showing all of the structures and a few additional ones. Supraorbital foramen, that's where some pretty major blood vessels come out that serve the skin of the face. You have the mental foramen down on the bottom of your chin. Again, nerves and all of the face come out there. This is an actual human skull preserved by someone who donated their body to science. The cadaver was cleaned and had all the tissue removed. Again, you see the very delicate inferior nasal conchae bones. There's the zygomatic bone, the frontal bone, the supraorbital foramen again. Again, eye sockets there, the nose, the teeth, and all those bones that we've talked about. All right, some other structures in the skin, in the bone. All of these little, in the skull, all of these little sort of, you think about a map, they kind of look the way rivers look on a map. Those are the sutures. And you have some major sutures that are evident on the skull, and I'm sure we will take a closer look at those later. But this is simply showing you that at this point right here, the skull is a very well-made, very protective structure. It's there to protect the brain, but it does have a weak spot. There is a weak spot right here in the temple where all of these bones come together. The parietal bone, the frontal bone, the sphenoid bone, and the temporal bone. They all come together right here in this little area. That is the weakest spot in the skull. Again, it's right about here. Can be very dangerous to head injuries. This is one of the things, if you're a football fan and you hear about the targeting, one of the things they are trying to get out of football is traumatic head injuries. You know, you don't want to lead with the top of your head. That can lead to head injuries, but it can also lead to neck injuries. But one of the things they are majorly concerned about is this spot right here, which is somewhat unprotected in a football helmet. If you sort of envision where a football helmet goes, it comes around here and then it comes down here. And that area right there, and if you look at some players, that area of their head is somewhat exposed. So that's why they're trying to get all the head contact out of sports. You'll notice a lot of baseball players now are wearing that batting helmet. In addition to having that ear flap, it's got another piece of plastic that comes around like that to offer more protection to the eye and the side of their face. Again, look at the same structure on a real skull as opposed to the artist's rendering of a skull. Here's the back of the skull showing the sagittal suture. That's the suture that connects the two parietal bones. Here is the occipital bone. Finally get a good look at it. This is what is called the lambdoid suture. This one here, that's the sagittal suture, the lambdoid suture, the squamous suture runs over here. Some other structures you can see, the mastoid process, that's where it's going to sit and form an articulation with the jawbone so that we can open and close our mouth. Here's a view from the top of the head, again showing the two parietal bones. Here's the coronal suture. That's at the front, right across here. Think about the beauty queen where she wears her crown. That's where we get the word coronal suture. Sagittal suture runs up through the middle. The lambdoid suture runs here. You see these two little bones here. Hopefully there will be a slide here that will tell us what these are. But those are called sutural bones. What happens when you are born? All of these suture lines are open. That allows for growth of the skull as you grow and mature. As you grow, they will all close up. Occasionally, what will happen in a significant number of people is these lines will fuse and there'll be an opening there. And what the body then does, it will just lay down bone tissue into that little void space and fill up that area where these two bones didn't completely fuse together. Some other structures, looking at the underside, foramen magnum. Literally, The word foramen magnum means big hole, and that is a big hole. That's where your spinal column and the base of your brain is going to exit the skull and go down into your spinal column. Again, same old bones, the occipital bone, the two temporal bones. This structure right here is the carotid canal. That's the area where your carotid artery from here is going to go up inside your skull. You have the jugular foramen. That's where your jugular vein is going to exit. Again, here's those nasal conchae bones, the zygomatic bone, just a review of all the other structures. Cross-sectional view of the inside of the brain or inside of the skull. Again, the occipital bone here to the back, the parietal bone to the side, frontal bone to the front. Some of these bones that we weren't able to see very well in other views, the vomer bone, for instance, there it is. You can see how large it is. There's the cross-section showing the different kinds of sinuses. And again, looking at a dissected cross-sectional view of an actual human skull. The interior looking down, again, many of the same structures we've looked at before. You can now see structures that you might not otherwise see. The greater and lesser wings of the sphenoid bone. My old A&P instructor over at ULR said that the sphenoid bone looks like a bat. And if you kind of look at it, it does sort of resemble a bat. Last few things about the skull. Frontal bone, the one we commonly refer to as our forehead. The two parietal bones found on either side of the vault. The occipital bone found in the back. Major characteristic or structure is the foramen magnum. There's the temporal bones, the medial view and the lateral view of the temporal bone. There's the inferior view of the temporal bone looking at it from the bottom. You may have noticed over in the lab, there's one of those skulls. It's one of the multicolored skulls that has actually fallen apart. That actually is a skull that is designed to disassemble and then have students reassemble it. The problem with those is after you've disassembled it and reassembled it about twice, then the little pins that are supposed to hold the bones together don't hold the bones together anymore. So at that point, the skull is just laying out on the floor or on the table. Excuse me. And it won't go together. But it does allow you to see these bones and what they look like. Some of these bones, when you're looking at them in the skull, they look rather small, but then when you take the skull apart, you see that, that temporal bone looks small, but it's pretty good size. That sphenoidal bone is pretty good sized as well. There's the face bones of the face, again, showing the lacrimal bone, the nasal bone, and the zygomatic bones. The zygomatic arch is this structure here, the component. And when people go in and have plastic surgery or cosmetic surgery and alter, what a lot of times they will do is actually shave down that zygomatic arch to make their cheekbones stand out more, be more prominent. Then we have the palatal bones, the mandible, showing that mandibular condyle, which is where it's going to articulate with the other bones. The maxilla, the upper jaw, and there's the other side. Here's the one for the right, there's the one for the left, showing them from two different angles. Then there is the inferior nasal conchae bone. There's also a middle nasal conchae bone and a superior nasal conchae bone. The vomer bone, again, there it is right there in the middle, forms sort of the backbone of the roof of your mouth. So that's the skull. It can be hard to appreciate the skull bones in terms of their structure and how they relate to one another. Again, figure 7.10 shows a disarticulated or exploded skull where the bones are separated, so each bone is visible, showing how they fit together. Think of the skull as a three-dimensional jigsaw puzzle with pieces taken apart and separated. Best way to appreciate the structure in complex bones such as the ethmoid and sphenoid and observe how they relate to other bones. And as I said, we have a skull in the lab that pretty much falls apart anytime anybody touches it. And there is my exploded, disarticulated skull. Cavities of the skull, the orbits, this is where you're going to find your eye. It's complex anatomical structure of 7 fused bones. It encases the eyeball, but also the lacrimal gland, the associated blood vessels, muscles, and nerves. The bones included are the frontal bone, the maxilla, the zygomatic bone, the sphenoid bone, the ethmoid, lacrimal, and palatal bones. All of those bones articulate to form the orbit of the eye. And here's the frontal bone, the ethmoid bone, the lacrimal bone, the palatal bone, zygomatic bone, and the sphenoid. All of those bones come together to form the eye socket. The nasal cavity has several bones, which are all lined with mucous membrane to form the walls of that cavity. They are the first part of it is the first part of the respiratory tract. The posterior wall of the nasal cavity is made up of the sphenoid body and the pterygoid processes. The lateral wall is made up of, sphenoid bone, ethmoid, inferior nasal concha and maxilla. So the lateral wall is made up of the ethmoid and perpendicular plates of the palatal bone. The cribriform plate of the ethmoid bone forms the roof of the nasal cavity. The cribriform plate is a structure in the ethmoid bone that is full of holes. It is designed to have things pass through it like arteries, veins, nerves, lymph vessels, all sorts of other things. The most interesting thing I can tell you about the cribriform plate is if you know anything about ancient Egypt and the mummification process, the Egyptians felt that the organs inside your body, lung, heart, stomach, intestine, kidneys, all of those were very important. They didn't think the brain was very important at all. So what they would do in the mummification process is they would split the body open. They would take the 2 lungs and they would put them into these specially constructed jars. They would put your stomach in a jar. They would put your intestines in a jar. They would put your lungs in a jar. And then to get your brain out, they would take a metal hook and ram it up your nose, breaking through the cribriform plate. Then they would take the metal hook and just jiggle it back and forth and ram it up and down and just pulverize the brain tissue and then tilt the mummy upside down and let the pulverized brain tissue run out your nose. So again, all through the cribriform plate. They were able to get the brain out without disrupting the skull and head. The nasal cavity, the floor of the heart or hard palate, it's the palatal and palatal process of the maxilla. Cartilage and connective tissue of the nose are attached to the margins of the nasal bone and the maxilla to form the anterior wall of the nasal cavity. The nasal septum is posterior to the perpendicular plate of the ethmoid and vomer bone. It is anterior to and anteriorly it is hyaline cartilage. It divides the nasal cavity into 2 nasal fossa. Think about the line that runs up the middle of your nose. You know, everybody has had that cold where this side you couldn't breathe at all out of this side seemed to be fine. Or you couldn't breathe out of this side seemed to be fine. There's also a condition known as a deviated septum, where the septum is not straight up and down, it's off to the side or twisted. I have a deviated septum. I was in an automobile accident when I was a junior in high school, smashed my face into the dashboard of a Ford F-150 pickup truck. I think they were F-150s, maybe an F-100. Anyway, 1977 pickup truck. I slammed my face and broke my nose, and it's fixed itself. It healed crooked. In my adulthood, went to the doctor because I do have a lot of sinus problems in the fall and the spring. And my doctor told me part of it was because of my deviated septum. I went to the doctor to have my deviated septum fixed. And he said, well, what we're going to do is we're going to stick this thing, and it looked like a screwdriver. up your nose, and I'm going to hit it with this hammer, and I'm going to break your nose and reset your nose. And I said, never mind, I'll live with it. All right, so Ben, cavity of the skull. There is the sphenoid sinus, named because it is found in the sphenoid bone. There is the cribriform plate. You see, there's the opening of the nose. You go right up, you punch through that little plate, and there's the brain right there. There's the frontal sinus. If you've ever had one of those headaches, and it's just, oh golly, it's just right here. That's your frontal sinus giving you fits. Some other structures. Let's see, there's the cribriform plate, frontal sinus. That's good. All right, there are the different nasal conchae bones. You will see that you have the superior, the middle, and the inferior nasal conchae, but if you look closely, they're all one bone. It's just the bone has these little ribs on it. The paranasal sinuses found within the frontal, sphenoid, ethmoid, and maxillary bones. They are used to communicate with adjacent nasal cavities through small bony openings, which allow air to flow in and out of the sinuses. The mucous membrane lines the sinuses. The function of the sinuses is to filter, warm, and humidify air that you breathe in. These cavities also reduce the weight of the skull, and they also play a role in your voice production or voice resonance. Everybody knows that when you have a bad cold and your nose is all stopped up, you sound funny. You talk funny. You talk like this because the resonance is not there because that sinus cavity isn't able to flow like it should. Your tongue, teeth, and most of your salivary glands are found within the oral cavity. The oral cavity is the beginning of the digestive tract. You have the roof of your mouth. The roof of the cavity is the inferior surface of the bones that form the floor of the nasal cavity. So above is the nasal cavity, below is the oral cavity. The anterior and lateral walls, that's front and sides, of the cavity are the maxillae and the mandibles. The posterior wall and the bony floor here are absent. They are replaced by the soft tissue, muscles, and connective tissues found under here. So there is, again, the cross-sectional view showing you the structure of the oral cavity right there. Fetal skull, the bones are not fused to one another like the bones of the adult skull. Everybody knows, well, most everybody knows that babies have what are called soft spots. The clinical term for those are fontanelles. This is a membranous area between the cranial bones of the fetus. They are present until the child's cranial bones complete development at about 18 months to 2 years of age. The fontanelles and unfused structures allow for flexibility. It enables the skull to fit through the mother's vaginal canal during birth. Also allows the skull to enlarge with normal brain growth, again, following that structure function principle. It is not unusual at all for a little baby to be born with a cone head because their head has been compressed through the birth canal and their little head is kind of pointed. It will flatten out and take on its normal shape after just a few hours. The anterior fontanelle is going to be found right about in here on the baby's head, between the developing frontal and parietal bones, where the coronal and sagittal sutures meet. Metopic sutures divide the frontal bone and fuses at birth to form a single bone. The posterior fontanelle, found a little farther back in here, is between the developing parietal and occipital bones at the apex of the lambdoid suture. You have two sphenoidal fontanelles on the left and right sides of the temple, right here, where the sphenoid bones meet, and you have two mastoid fontanelles at the conjunction of the lambdoid and squamous sutures of the developing parietal, temporal, and occipital bones. Those are back over there. So there's the frontal one, there's the anterior one, there's the sphenoidal fontanelle, posterior fontanelle, and the mastoid fontanelle. Just a superior view of the skull. Again, there's the anterior one. That's the one that's most often seen and everybody knows about. Here's the lambdoid, or excuse me, the posterior fontanelle there. There is a fetal skull. Again, there's the anterior fontanelle showing the frontal suture. The hyoid bone is an interesting bone. It's not technically part of the skull, but it's not technically part of anything else either. So we have to include it somewhere, so we include it here. It's grouped with the skull bones because of its proximity, although it doesn't articulate with any of the skull bones or any other bones for that matter. It is a C-shaped bone in the superior portion of the neck. It is suspended by ligaments that attach it to the styloid process of the temporal bone and the larynx, the voice box. It provides numerous attachment points for the muscles involved in swallowing and speech. The hyoid bone is found right up in here, crosses this way underneath on the skeletons in the lab. You can see where it goes. They have it affixed in the proper place. And there it is right there. You see where you see it. There is a blow up of the structure. This is called the body. Then you have the lesser horn and the greater horn. There is it in place. Interesting point about the the hyoid bone is it is almost always broken when someone is manually strangled. However, it is almost never broken when someone is hung. That is because when someone manually strangles you, they come at you like this, and they put a lot of pressure right here, right? But when someone is hung, the pressure's off to the side, and generally what happens in a hanging is it breaks the neck. Interesting thing, if you know who Jeffrey Epstein is, he's the multi-billionaire that was arrested on some child pornography charges or something. He was in federal prison on a suicide watch, and he somehow managed to hang himself and kill himself. However, upon autopsy, it was discovered that his hyoid bone was broken and his neck was not broken. Again, doesn't prove anything, but it is rare for a hanging victim to have a broken hyoid bone and not have a broken neck. All right, so we're going to stop for the moment. I'm going to get something to drink, take a rest for a few minutes, and then I'll be back.